There's a campaign to promote the proper and consistent use of medications sponsored by the American Pharmacists Association Academy of Student Pharmacists. To tell us about the campaign are two of those student pharmacists, Rachelle St. Fleur and Amit Hirani. Thank you both very much for being with us.
Thank you for having us.
I want to start with Rachelle. We're talking about problems with medication adherence, people who don't take it the right way. How big a problem is this?
Well, according to the National Consumers League, 45% of our population has a chronic condition, and nearly 3 out of 4 Americans don't take their medications as prescribed by their healthcare providers. So right now we're seeing it as a huge problem for our nation as a whole, especially in Massachusetts. And what happens with these chronic conditions such as high blood pressure and high blood glucose or diabetes, it can lead to other cardiovascular events. With uncontrolled high blood pressure, it can lead to heart attacks or a stroke or more time in the hospital. And with diabetes, it can lead to vision abnormalities, kidney problems, diabetic foot ulcers. So it can lead to a lot of different problems, and we're here today to kind of get to educate Boston in taking their medications as prescribed.
Now, we're not really talking about someone who has to take a standard dose of just one medication for a long time. We're talking people who take multiple medications, they have many problems, they've got to be monitored by doctors. To me, that sounds like it's easy to lose track of things.
It's very easy. Implementing a different routine into your life, it's hard with a bunch of different medications sometimes, and life is happening, and just remembering I have this to take every day, it's hard to implement. So
I mean, talk about how pharmacies come into the picture here. Obviously they're the place where you go to get the medications, but how do you do things better?
In terms of the pharmacy, side, we try to counsel our patients. We try to give them the most effective information regarding not only their medications, but we have a big profile of all the medications that they're taking. So on the pharmacy side, what we do is we look at their medications and see what type of interventions we can make in terms of drug interactions, or if we can simplify the dose. And what Rachel's going to talk about today is ways to which we can have our patients become more adherent to their medication.
What about that, Rachel? What can they do as far as getting the patients to stick to this better?
They can go to their local pharmacy and get pill boxes, monthly pill boxes, weekly pill boxes to kind of remember. Everyone has a phone nowadays. Setting alarms on your phone just to keep that reminder for you. Getting your family members involved in that also. Telling them, I have this condition and I need to take my medications every day. Could you just remind me? Because this is for my health. This is for our family as a whole.
Amit, what about some of the things that are going to be changed, because there has been some legislation passed recently, some of it in response to the opioid crisis?
Yeah, absolutely. So in regards to some of the current legislation, there's one called the Provider Status Bill. And when I talk to patients and people in the community regarding this bill, I like to ask them a series of questions, and I want to ask you a series of questions as well. And members of our audience can also answer along as we go. Mr. Levitt, do you consider physicians to be healthcare providers?
Normally, yes.
Would you consider a nurse to be a healthcare provider?
Yes.
Would you consider a dietitian to be a healthcare provider?
Yes.
Would you consider a chiropractor to be a healthcare provider?
I haven't been to one, but anyhow, I think I know where you're getting at here, because, in other words, is a pharmacist a provider or just a dispenser?
Yeah, and absolutely, that's the real problem. Pharmacists are not recognized as healthcare providers under federal law, and really that's the issue. And it baffles my colleagues and peers, because we go through such extensive training and education with medications. I mean, we come out with our doctorate, yet Medicare and Medicaid, the legislation that dictates that, do not consider us as providers, and it's becoming a little difficult. So to really answer your question, we have to see what the roles of pharmacists are now. And the quintessential role of a pharmacist behind the counter, counting pills and counseling patients and recommending over-the-counter medications as well, it's changing. We are recognized to have a skill set, a knowledge of medications and chronic diseases. So what we're seeing now is pharmacists are moving out into the community. They're assuming different types of roles with their clinical knowledge set. More specifically, is the service Medication Therapy Management, or rather MTM. And what the service does is you sit down with a pharmacist and a patient, and we go over all of your medications. We ask questions such as, how are you taking this medication? What kind of adverse effects are you having? And what kind of challenges are you having with your medication as well? And the question we get is, well, what's the difference between that and what you do at a pharmacy, really? Because there's a big mystery as to what we do as pharmacists. And the big difference really is that with medication therapy management, we're sitting with our patient and we're offering a very comprehensive service that goes over not only their medication, but the pharmacist then can set goals for the patient. We can also do such services as diet and exercise, nutrition, supplementation as well. Pharmacists with this practice can amend medication. They can add medications, they can change doses, simplify the regimen for the patient. Really, medication therapy management, this service, is one that empowers the patient, really. The aim for pharmacists under this service is really to confidently have our patients manage their own medication and really not have the disease define the patient. But unfortunately, without this provider status, we as pharmacists, are not able to bill for this service because we're not considered providers under the legislation of Medicaid and Medicare.
Rachelle, it seems you've got some challenges to do this job, right? Because when you're dealing with patients, there could be language differences, cultural differences. You might be even talking about vulnerable populations. Can pharmacists really do much to handle those challenges?
With those challenges, I think that the patient and the pharmacist should establish a relationship. And by doing that, they'll be able to kind of better assist the patient. They'll be able to know the barriers and the things that are blocking them from maybe taking their medications or what they're going through on a daily basis. And by doing that, we can better serve our patients.
I mean, what you're talking about is the kind of service, the healthcare providing that we associate, at least with community health centers. Maybe not so much the big impersonal institutions, but is there? You see a gap out there still that needs to be filled, even with all those community-oriented health centers around Boston?
Absolutely, there's a high demand for having pharmacists within different institutions. Take for example the VA. The VA is an institution that's integrated pharmacists into their practice settings, and throughout the 10, 20, 30 years they've had pharmacists on board. There's data to show that not only does it improve health outcomes for our patients, patients can save money, and ultimately healthcare as a whole can save money. Medication adherence costs the US government $90 billion, that's with a B. And there's a lot of implementation of pharmacists in different types of practice settings. So like I was saying, medication therapy management is a huge one. But then there's other settings where we can talk about patients who have chronic pain. As we know here in the Commonwealth, opioid overdose is at an all-time high. So there's definitely ways that we can educate our patients as to how to efficiently use their medications.
Rachelle, we should mention finally, if people would like some more information about this campaign and medication adherence, you've got a website that they can check out?
Yeah, if they would like more information about the campaign or even just some tools and resources to better help them take their medications, they can go to www.scriptyourfuture.org. And on there, they can sign up for text reminders. They can find out more about their conditions also.
Thank you both very much, Rachelle St, Fleur and Amit Hirani. Up ahead, the report from Dorchester with Bill Forey.